Hello, my name is Leah Swanson, and I'm a Registered Dietitian Nutritionist. Thanks for joining me. Today we're going to talk about cholesterol. What is it? Where is it found? Why should I care? And how to keep that cholesterol in check. First of all, what is cholesterol? Cholesterol is a waxy substance that is not bad by nature. Our bodies actually need it to build cells and to make hormones and vitamin D. It also aids in digestion. But too much cholesterol can be a problem. Cholesterol is made by your body and can also be found in animal foods. However, foods that contain cholesterol do not necessarily raise your cholesterol level. We'll talk more about this shortly. Your liver makes all the cholesterol your body needs. However, what we eat can cause our liver to make more than it needs. Foods that are high in saturated fats and trans fats can cause your liver to make more cholesterol than it normally would. Eating too many foods on a regular basis that are high in saturated or trans fats can make your cholesterol level go into the unhealthy range. Now, you've probably heard of LDL and HDL cholesterol. HDL cholesterol is called the good cholesterol and actually removes cholesterol from the bloodstream and artery walls. Think of the H in HDL as higher or healthy. Since HDL is good cholesterol, we want this number to be higher. HDL cholesterol can be lowered by genetic factors, type 2 diabetes, smoking, being overweight, and being sedentary or not getting enough movement regularly. So, the things that we can control here are physical activity, stop smoking, and losing weight as appropriate. LDL cholesterol, or the bad cholesterol, puts cholesterol in the artery walls, starting the buildup of plaque in the arteries. Think of the L in LDL as lower or lousy. Since LDL is the bad cholesterol, we want this number to be lower. LDL cholesterol can be increased by a diet that's high in saturated and trans fats. In addition to HDL and LDL cholesterol, there are triglycerides. Triglycerides are a specific type of fat in the blood. In fact, they are the form in which most fat exists, in both food and your body. Triglycerides are stored in fat cells and are used as energy by the body. Often people with high cholesterol levels also have high triglyceride levels. High triglyceride levels can be a sign of excess calorie consumption, especially from foods that are made from refined grains like chips, cookies, and cereals, as well as foods and drinks that contain added sugars. Triglycerides are also often high in people who smoke or drink a lot of alcohol. Know your numbers. The American Heart Association recommends that all adults over the age of 20 should have their cholesterol, as well as other risk factors, checked every 4 to 6 years. High cholesterol doesn't typically have symptoms, so that's why it's especially important to get it checked. To get your levels checked, your doctor will do a blood test called a lipid profile or a lipid panel. This includes total cholesterol, LDL cholesterol, HDL cholesterol, and triglycerides. Your cholesterol is measured in milligrams per deciliter of blood. Your total cholesterol score equals HDL cholesterol plus LDL cholesterol plus 20% of your triglycerides. Desirable levels, according to the CDC, for total cholesterol are less than 200 milligrams per deciliter. For LDL are less than 100 milligrams per deciliter. And for HDL are greater than or equal to 60 milligrams per deciliter. It's important to remember that your numbers alone are not enough to predict heart problems. Your doctor will use your numbers in combination with your family history, age, gender, and other lifestyle factors like smoking to determine your risk. Check out the link on this slide to use the American Heart Association calculator to estimate your risk. What causes high cholesterol? There are many things that can affect your cholesterol levels. Genetics. High cholesterol can be inherited from family members. Age. As we get older, our cholesterol levels can rise. Medicine. Some medications can increase our cholesterol levels. Weight. People with obesity or who are overweight are at an increased risk of high cholesterol. Diet. Eating high amounts of saturated fats and trans fats can raise LDL cholesterol. Inactivity. Being physically active helps to raise HDL cholesterol. On the other hand, inactivity can increase LDL cholesterol. And finally, smoking. Tobacco products decrease HDL and increase LDL cholesterol. This includes smoking or exposure to tobacco smoke. Why should I care? The more cholesterol that's found circulating in your blood, the higher the risk to your health. As I mentioned, if there is too much LDL cholesterol or bad cholesterol in your body, it can build up as plaque in the bloodstream, which can make the arteries narrow and less flexible. If a blood clot forms and blocks one of these already narrow arteries, it can cause a heart attack or stroke. So, let's monitor that cholesterol to keep the heart healthy and lower the risk of heart disease and stroke. Before we dig into the good stuff, I want to give a quick update on the idea that eating foods that contain cholesterol will raise your blood cholesterol levels. We know that the liver makes most of the cholesterol in your blood, and it's actually food that's high in saturated and trans fats that increase your cholesterol. This is because foods that are high in saturated fat and trans fats stimulate the liver to make more cholesterol than your body needs. So, that means that eggs are back. Eggs used to have a bad rap because of their high cholesterol content, but now we know that this isn't really a concern. Eggs are actually an excellent source of protein, yolks included, because they're packed with vitamins, mostly in the yolk. And research has shown that eating up to 1 egg per day is safe and healthy, as long as you're not frying it in lots of butter. So you found out that you have high cholesterol. What can you do? Limit your intake of saturated and trans fats. Saturated fats are found mostly in animal foods, like meat and whole-fat dairy products. This includes fatty meats, full-fat dairy, cheese, and tropical oils like palm oil, palm kernel oil, and coconut oil. A high intake of saturated fat is associated with an increase in LDL cholesterol. Studies have shown that replacing saturated fats with unsaturated fats can help decrease both total cholesterol and LDL cholesterol. Here's a few tips to limit your saturated fats. Instead of using butter, coconut oil, or lard, cook with vegetable oils such as olive oil, canola oil, sunflower oil, or safflower oil. Eat foods that are rich in omega-3 fatty acids, such as fatty fish, walnuts, and ground flaxseed. And instead of full fat, choose low-fat or fat-free dairy products, like 1% or skim milk, non-fat yogurt, and low-fat cheese. Next, we're going to want to avoid trans fats. Trans fats can be found in highly processed foods and can increase LDL cholesterol. Look for hydrogenated fat in the ingredients list and choose a different option if you see this as an ingredient. Trans fats are often found in fried foods, store-bought donuts, baked goods, cakes, pie crust, biscuits, frozen pizza, cookies, crackers, and stick margarines. Make sure to check out the nutrition facts panel to see if there are any trans fats. However, if there is less than 0.5 grams of trans fat per serving, then it can be listed as 0. Another way to look for trans fats is by looking for partially hydrogenated oils on the ingredients list. The next thing you can do is to choose lean proteins. Look for the words round or loin. You can also look for choice or select rather than prime, since these are lower fat cuts of meat. Take the skin off your poultry, such as chicken or turkey, and trim your meat before cooking to remove as much visible fat as you can. Try alternative cooking methods to frying for cooking your proteins, such as baking, broiling, roasting, stewing, or stir-frying. You can even use a rack to drain off the fat when cooking in the oven. After you cook ground meat, drain off the fat, and limit fatty meats with visible marbling and fried or deep-fried foods. It's also a good practice to limit processed meats like sausage, hot dogs, bacon, and salami, which are typically high in both fat and sodium, which is another important nutrient to limit when you're keeping heart health in mind. Taking it one step further, you can eat less meat altogether. Choosing lower fat meat options is a great way to reduce your saturated fat intake, but going meatless, even if it's just for one day per week, can also be very beneficial. I challenge you to try substituting plant-based proteins like beans, tofu, and tempeh for meat one day a week. Next up, fiber. Fiber is found in fruits, vegetables, beans, lentils, and whole grains. These foods contain both soluble and insoluble fiber, both of which are really great for your health. Research has shown that soluble fiber in particular can help to lower LDL cholesterol. Soluble fiber binds to fatty acids during digestion, which means that less cholesterol will stay in your body. Foods that have a good amount of soluble fiber are oats, peas, beans, lentils, apples, citrus fruits, carrots, barley, psyllium, chia seeds, and ground flaxseed. Note that this is ground flax seeds and not whole flax seeds. If you eat whole flax seeds, they certainly won't hurt you, but they will go right through you without providing the benefit of that soluble fiber. So, how do I increase my fiber intake? Eating a variety of different colored fruits and vegetables will help you to add more fiber to your diet. Look for whole forms of produce, which includes fresh, frozen, canned, and dried. Choose low sodium or no salt added canned vegetables and beans, and drain and rinse them before using to further cut back on sodium, which is also important for heart health. If you choose canned fruits, look for those packed in water or their own juice to avoid extra added sugars. Swapping out refined grains for whole grains is another great way to increase your fiber intake. Barley, oats, and oat bran are all good sources of soluble fiber. When you choose bread, look for packaging that says 100% whole grain or lists a whole grain as the first ingredient. Keep in mind that multigrain does not mean whole grain. You want 100% whole grain or whole wheat. Shift to more plant-based or vegetable meals. This might mean swapping out meat for beans, lentils, tofu, or tempeh several times per week, or even using meat as a garnish to your meal instead of as the main event. One thing to note is that you'll want to increase your fiber intake slowly. If you're not used to eating a lot of fiber and increase the amount that you eat quickly, you will likely have some digestive discomfort. Also remember to drink plenty of water. This will help keep things moving as you increase fiber and will help prevent constipation. STANOLS and STEROLS. Some foods contain substances that naturally occur called stanols and sterols. These substances are found in plant foods and can help decrease total cholesterol and LDL cholesterol levels by blocking cholesterol from being absorbed. Foods that contain stanols and sterols are vegetable oils, vegetable oil-based margarines, nuts and seeds, whole grains, and foods fortified with stanols and sterols, such as orange juice, cereals, and breakfast bars. You'll have to look at the label to check for this addition. Eat more fish. Fish ranges from lean to fatty, but the type of fat in fish is mostly unsaturated, or the healthy type of fat. The recommendation is to eat at least 2 4-ounce servings of non-fried fatty fish per week. Choosing fish that are fatty, like salmon, herring, sardines, and trout, will give you the heart-healthy benefit of omega-3 fatty acids. In fact, research has shown that including seafood that is high in omega-3 fatty acids in your diet can help reduce the risk of heart failure, coronary heart disease, heart attack, and stroke. This is especially true when you replace proteins that are high in saturated fat with these fatty fish. Mix up your cooking methods. Steam, sauté, or roast your veggies instead of frying in oil or butter. Or decrease the amount of oil you use and add a little water if needed to finish cooking your veggies using steam. You can also add herbs and spices for flavor instead of heavy sauces and saturated fats. Replace solid fats with liquid vegetable oils. Saturated fats are typically solid at room temperature. Think margarine, lard, butter, and coconut oil, and try to swap these out for fats that are liquid at room temperature. As I previously mentioned, you can try swapping these out for liquid oils, like olive oil, canola oil, or safflower oil. Baking swaps. Replace all or part of the fat in your baked goods with unsweetened applesauce, mashed banana, pumpkin puree, or sweet potato puree. This works well in muffins, cookies, and quick breads. You can even try substituting shredded zucchini or mashed black beans for part of the fat in brownies. Have some fun with these swaps and don't be afraid to get creative. Lower dairy fats. Swap out higher fat dairy options with 1% or fat-free. This is great, especially in dishes that call for half and half or whole milk. For cheese, try swapping out whole milk versions for low-fat, low-sodium cottage cheese, part-skim mozzarella, or other low-fat, low-sodium cheeses. Low-fat plain Greek yogurt also makes a great fat alternative for baked goods like muffins and quick breads. Now I know I've talked mostly about dietary changes, but physical activity is another key piece of the puzzle when it comes to lowering cholesterol. Try to aim for 150 minutes or 2.5 hours of moderate intensity aerobic exercise per week. You don't have to be a marathon runner or even a runner at all. Find what works for you and what you can stick to, whether that's neighborhood walks, taking water aerobics at your local pool, or riding a bike. Although this presentation is focusing on cholesterol, sodium is another very important nutrient to pay attention to when it comes to heart health. Be sure to check out our Low Sodium Living video to learn more about this topic. In general, the recommendation is to eat no more than 2,300 milligrams of sodium per day. However, ideally you would eat no more than 1,500 milligrams of sodium per day. Our presentation on this gives you lots of helpful tips and tricks to keep that sodium low. Along with this presentation, you should receive handouts, including cholesterol, myths versus facts, how can I improve my cholesterol, and how do my cholesterol levels affect my risk. Thank you so much for listening. Feel free to check out our website for more information or reach out to us by phone. And thank you to our sponsors, both Verdant Health Commission and Stille Valley Health Connections.